The health of our cells depends to a large degree on their ability to keep toxic material out. This includes toxic or unbiological chemicals, endotoxins produced by microbes inside the body, and also harmful concentrations of otherwise useful biological chemicals. Such toxic matter tends to weaken and disrupt the energy production within cells, and is a major factor in disease processes, such as cancer and chronic fatigue syndrome. Toxic chemicals, together with useful ones, can enter inside the cells only through special pores in the cell wall. In healthy cells, the entrance ports of these pores are protected by special gatekeeper chemicals, mainly the calcium salt of 2-aminoethanol phosphate, also called cholamine phosphate, or short, CMIF. This CMIF is heavily concentrated at these entrance points and is attached to the cell wall, where it keeps the calcium in a fixed position. In addition to keeping unwanted chemicals from entering, CMIF is also effective in transporting essential minerals through the cell wall and into the cell. In addition, it helps to maintain and restore normal electric cell potential between both sides of the membrane. Because of its vital functions in maintaining the health of the cell membranes, CMIF has been called the membrane integrity factor, or vitamin MI. With increasing age and disease-related health deterioration, we do not seem to be able to produce enough CMIF to protect our cells. This leaves them open to attack by undesirable chemicals and toxins, and can cause or contribute to a wide range of diseases. CMIF salts were developed in the 1960s in Germany by Dr. Hans Nieper and produced by a small chemical company, Dr. Kröller Chemie. Initially, calcium CMIF was mainly used in the successful treatment of multiple sclerosis. Also, damaging after effects of viral infections, such as chronic fatigue, could greatly be reduced. Other diseases that responded well were allergies, asthma, blood pressure and circulation problems, capillary bleeding, cancer, chronic kidney disease, diabetes, lateral sclerosis or ALS, leukodystrophy, and osteoporosis. Varicose veins stopped deteriorating and aging skin was improved. Dr. Nieper actually mentions that patients on long-term CMIF therapy hardly age, neither outwardly nor by some inner criteria. A mixed formulation of calcium, magnesium, and potassium, CMIF is calming and harmonizing for the nerves, and with this, suitable for neurological conditions, including hyperactivity and anxiety disorders. After evaluating the treatment of several thousand multiple sclerosis patients over many years, Dr. Nieper found that hardly any one of these patients had developed cancer. Also, in a 6-year study of 8 patients with repeated surgery for colon cancer, there were no further recurrences with calcium CMIF therapy. A report from the Johns Hopkins University states that by using agents that elevate the intracellular calcium level, even fast-growing metastatic cancer cells could be made to undergo programmed cell death. We know today that cholamine phosphates are part of neurotransmitters, that is, substances necessary for conducting an electric signal to biological structures. In addition, the substance is obviously necessary to retain electric charges, especially of calcium, on the membrane surface. In this way, the cell membranes can function like an electric condenser, except that the areas containing the charge do not consist of metal, as they do in technology, but of biologically retained calcium linings. Since 1963, we started to apply calcium and magnesium CMIF clinically with the intention of protecting the cell membranes against unwanted intruders, such as antibodies, toxins, and viruses. These can only enter through the so-called free lipid pore of the cell membrane, where the cholamine phosphate is in position. We presumed, therefore, that the supply of calcium CMIF would have a special sealing function. Our expectation proved to be correct. Already in 1971, Monninghoff, in Munster, Germany, published electron microscopic research demonstrating in a spectacular manner how the sealing of cell membranes with calcium CMIF could prevent penetration of peroxidase granules. In the case of multiple sclerosis, cell membrane damage exists throughout the body, showing especially in myelin, a multiple condenser winding around the central nerve fiber. Multiple sclerosis is not a neurological disease, but a generalized disease of the cell's membrane system. It also affects the bone matrix system, the kidneys, the membranes of the pulmonary alveoli, and the urinary tract system, the inner linings of little vessels, the membranes of red blood cells, as well as many other sites. First of all, for all practical purposes, patients under this treatment hardly age, neither in their outward appearance nor by any other criteria, like tissue elasticity, skeletal firmness, absence of osteoporosis, etc. While formerly 1/3 of all MS patients would die of lost nerve functions, and another 1/3 of increased tendency to bone fractures, and the last 1/3 to kidney failure, only 2 patients out of 2,200 did this. Unusual bone fractures and problems with kidney functions were not observed at all. Second to myelin of the nerve fibers, the kidneys are especially endangered in MS because the electrostatic defense against ascending bacteria that can damage the kidneys is no longer adequate because of insufficient membrane polarization in the cellular system of MS patients. We treated decalcification diseases including true osteoporosis not related to multiple sclerosis. The net results are apparently striking. I feel that the energetic membrane impairment in osteoblasts and of the bone matrix tissue is the true and deeper cause for decalcification diseases, including osteoporosis. Therapy with conventional calcium salts fail, as well does hormone therapy. In my opinion, there is no alternative to calcium CMIF for the treatment of bone decalcification. In asthma, there is a disturbance of the gas exchange on the membranes of the lung alveoli. In addition, there will be long-term degeneration of the lung, turning either into emphysema with the loss of alveoli or into a tendency of scarring in the connective tissue, causing fibrosis in the lung tissue. Regular treatment with calcium CMIF apparently results in normalizing the membrane functions in the cells of the lung alveoli so that the gas exchange can largely recover. The result? Now we almost have no asthma patients left, especially none of younger or middle age. A few weeks after beginning therapy with calcium CMIF, asthmatic reactions will subside and almost disappear. In diabetes, the usual problem is not the increased blood sugar level, but the consequences resulting from it. Excessive levels of glucose will produce unacceptable sugar deposits in numerous structures of the organism, ranging from the red blood cells to the cell membranes of this blood circulation system. Diabetes is the second most frequent cause of blindness. Increased resistance, high blood pressure, more clotting deposits on the vessels, varicose veins, etc. will result, as well as life-threatening thrombosis. During the last 24 years, we have observed that for patients taking calcium and magnesium CMIF, the development of thrombosis, circulation problems, high blood pressure, and the progression of varicose veins is almost entirely eliminated. The condenser functions of the cell membrane systems are repaired and maintained at an optimal level. This is true even for older patients. Naturally, this is accompanied by genuine youthfulness of the biological frame and certainly a substantially increased lifespan. We believe that the energy from condenser systems is required to activate gene repair of the cell plasma. These mechanisms, called oncostatins, can either block or extinguish genetic derailments on the way to a cancerous cell disorder. Therefore, with cancer, it is important to maintain an optimal condenser capacity of cell membranes. 3,600 MS patients had been treated by us with calcium magnesium CMIF when it came to our attention that the men, about 40% of the patients we treated, did not develop prostate adenomas or prostate cancer. In the winter 1992 Hopkins Medical News of the Johns Hopkins University in Baltimore, there is a report which says the following: androgen-independent cells, while all this is going on, experience no such increase in calcium. Although they possess a similar suicide pathway, it is not activated. But Isaacs and colleagues are killing these cells in the laboratory. Experimentally, we have been able to demonstrate that if we take the most poorly differentiated, metastatic, fast-growing, androgen-independent cell lines available, and we use agents that can elevate the intracellular calcium, the cells will then undergo programmed cell death and die.